Welcome to this virtual event by Health Tech Hub Copenhagen, and thank you for joining us today for our birthday. Woohoo! Before we get started with the agenda, I'll quickly go over some of the practicalities. First of all, we are recording this event, and for this and for other reasons, we ask you to please have your microphone and camera off during the session. If you have any questions, feel free to ask them in the chat as we go along. There will also be Q&A opportunities during the session, but don't hesitate to ask when the question pops up. We have several things on the agenda today. First of all, we'll go over the milestones for Health Tech Hub Copenhagen and our amazing partners. We'll also hear from some of our members and hear about their wins and their challenges. Then we have a special guest from Amazon to talk about their journey into healthcare. And after Laura's session, you can ask questions. Then we have an announcement to make. We're announcing the Health Tech Adoption Awards, which is a call to action for future nominees as well. And lastly, we have a session on what's next in health tech. So welcome everyone and enjoy the day. And welcome to Jesper, our CEO.
Thank you. Thanks, Denise, and sorry for the sound that woke you up. So I'm Jesper. I'm here to talk to you a few minutes about the highlights from last year and also share some of the success of our community, which means the success of our community equals the success of Health Tech Hub Copenhagen. So we're pretty happy to share some of these success stories as well. So just looking a little bit back, we're obviously reflecting on the past last year. Some of the highlights we had was, the slides were just giving me a little bit of problems here. No, we had a record-breaking year for health tech startups in general. We saw 500 million being reached alone in 2020. We had our startups creating 113 new jobs. We had one of our startups, Liva Healthcare, raised in January 185 million kroner, which was a record round. We've been lucky and happy to sign partnerships with the Bioinnovation Institute, the Ministry of Foreign Affairs, with Rigshospitalet, and before that as well, we also signed some other partnerships. So in total, the ecosystem has raised more than 900 million in equity funding the last 16 months, and we are reaching 2 million users with our member solutions. We've renewed all our partnerships and built a series of new partnerships that will benefit the entire ecosystem. And I think the most thing that we're mostly proud of lately has been that we've influenced, you've probably seen it, all of you, 2 weeks ago, the government announced a new life science strategy for the coming 3 years. And together with some of our startups, we've been working pretty hard to influence this strategy. And I think we have made a mark in terms of better use of health data, having Denmark as an exhibition window, and specifically paving the way for introducing apps for general practitioner to prescribe. And we are very excited about that. So that was some of my highlights. But now I would like to share with you some of the highlights from our startups. Yes, I will just mute and I'll just roll the video from some small videos from some of our member CEOs, which hopefully will give you some inspiration, where they will share some of their success stories and also some of their coming challenges.
Hi there, my name is Jakob Høj Bertelsen. I'm co-founder and CEO of Inversion. Our 3 biggest accomplishments last year, actually within the last month, is 1. Our product HTHC is one of few cases in the new Danish life science strategy. 2, we just hired a strong and experienced chief commercial officer to fulfill the huge demand from the market. And 3, we are just wrapping up the results around our other product, plus Prio Akut, so that it can be CE approved very soon. Our biggest challenge is within the next year, is to keep complexity down while we're scaling.
Greetings from Brain Plus here from a hopefully familiar office location. I'm Kim Christensen, the CEO and co-founder of Brain Plus. The last year has been a really exciting and interesting one where a lot of things have happened. We really got a strong new team together, onboarded a new management team, and have been really working on integrating that management team the last year. We got into a lot of really interesting dialogues with pharma companies and are maturing some of those, so that's really interesting. We started getting some traction with sales to the public sector, closed our first couple of 3-year recurring contracts with Danish municipalities, and that's something we intend to scale in the coming years. And we most importantly started to get positive interim results from some of our clinical trials within Alzheimer's disease, and particularly with emphasis and focus on being able to detect Alzheimer's disease early on. So that's really exciting. Also, we got some positive results from a small trial with dementia treatment that we have digitalized. So wonderful to be here at Health Tech Hub and to be part of the community, and look forward to seeing you soon.
Happy birthday, Health Tech Hub! And here's a quick recap of the last year for InjuryMap. More than 200,000 exercises completed. So proud to see users using the app. We can also see that 70% of users that get the app from their doctor reduce their pain. Finally, in February, we raised 6 million Danish kroner, which we actually haven't announced until now, I guess. So that's fantastic. And we're going to use that money to continue our growth, moving upwards, helping people around the world. Thank you.
Hi, I'm Nikolaj Hendriksen. I'm the founder of HiResmus. We managed to grow from 0 to 15 countries, which I think is pretty okay. We still have more ways to go, but that was a good start anyway. And we were trusted by EIT Health. We were trusted by Innovationsfonden. We were trusted by Nordic Health Tech. They trusted us to and help us fund some pretty good projects and some pretty bold projects for a startup like ours. So, and then finally, and what I'm most proud of, I think, is that we got the first feedback from a few families who were using our platform with some autism centers, and they were really positive, and they said that it had made a big difference for them and helped them in their lives with autism. Our challenges for 2021, it's gonna be pretty much the same. Honestly, we're going to continue moving really fast. So our main challenge will be to increase our pace and grow faster. And especially in the US, it's our main focus right now. And I know that winning in the US is something that takes guts, and it takes long hours. It takes funds and the right people and the right network. So yeah, but I have high hopes for this, and all the best to you guys.
Happy birthday, Hub. This is Anders Nysum from Visicon. The 3 biggest successes from the past year have been to have signed more 3-year contracts with new hospital departments than ever before. And we have received a great evaluation of our product on a new market that exceeded all expectations. And we have managed to grow and develop a highly diverse team of professionals, even during a pandemic. And the biggest upcoming challenge for us will be to secure all necessary resources to respond to the global interest in our solution.
My name is Simon. I'm the CEO and co-founder of Core Virtual Reality. So the big 3 achievements over the last year has been that we finished the software and launched a trial treating people who suffer from auditory hallucinations and schizophrenia. We also fixed all the bugs, so the therapists are now super happy using the software. And third, we had a documentary from TV2 following the first patients and where you can see the effect of the treatment. Our big challenge for the next year is regulation and funding.
Hi, my name is Lisanne. I'm the CEO of TrueBoost Technology. In bullet points, we have had a very good year the last year. We raised money with a private investor and Vækstfonden. We upgraded the team from being 1 to 8, and we entered the German market. And eventually we will also, for the next year, look hard at the French market and at selected countries in Scandinavia.
So the 3 successes for Liva the past year. Firstly, we have been working nicely into the market in the UK together with the NHS and our life science partnerships. That's very important to us. Secondly, we have established our German footprint in Berlin, and we're working towards penetrating the German market now. That will be our key focus area for us this year as well. And thirdly, our successful fundraising with Verinvest in December is something that we are really proud about. And the key challenge for this year is to work with the Danish market. We want to have a much larger impact in Denmark now, and we're working together with Health Tech Hub Copenhagen around these achievements.
My name is Thomas Lendenborg. I'm CEO at Monsenso, a digital mental health solution provider. Our largest achievements in 2020 were 1, that we continued our international expansion into 12 countries. 2, that we listed our company at Nasdaq First North, the local stock exchange, raised the capital to fuel our international growth. And 3, that we doubled our organization and attracted the right talent needed to take the company to the next level.
Thank you to all of our members for that. I need the presentation to continue, and then we're ready for the next thing on the agenda. Remember to ask questions along the way if you have any. And next up, we are welcoming Laura. And I hope Laura is with us and Laura is ready. And I will pass on the mic to her in just a second.
Thank you very much, Denise.
All right, welcome, Laura. You're from Amazon, and in a dialogue with our own Valentin, you'll be talking about Amazon's journey into healthcare. Welcome to you.
Thank you very much, Denise, and thank you, Valentin.
I cannot hear you, Laura.
Can you hear me now?
All good from here.
Ah.
All good from here, and it's
sorry, yeah, it was.
And it's very nice to have you here. Good morning, everybody. And as one of our colleagues would say, happy Thursday. Now we often talk about the extent to which tech will understand and enter health. Well, tech doesn't get much bigger than Amazon, so it's a great pleasure to have Laura here to tell us about their journey into healthcare. And Laura will start the presentation, after which we will have a short dialogue, which will be followed by an exciting discussion with all of you in the audience. And with that said, Laura, you have the stage.
Thank you very much, Valentin. So first off, thank you very much for having me. My name is Laura Modiano. I'm based in London, but I'm part of the global healthcare and life science team for startups for Amazon Web Services, which is the cloud service platform for Amazon itself. Can we move into my slides, please? So myself, I come from, I have 12 years experience within the healthcare industry. I've worked in Denmark itself as well. I spent a lot of time in the Nordics, Finland, Sweden, and Denmark, but I've worked in the US, in the UK, in France, and across Southern Europe. So hopefully I have a bit of insight into the industry as a whole, and I do understand where you're coming from. I come from startups myself. Before Amazon, I was had a business development for a startup in the industry, and I've worked in hospitals. So I'm extremely proud and excited about the work that everyone is doing. So Amazon's mission as a whole, and this is about Amazon, the company, not just Amazon Web Services, is to be the Earth's most customer-centric company. The guiding light that drives Amazon as a whole from inception to today is that everything we do stems from a specific customer need, and we work backwards from that. So we have a culture of innovation that, again, has guided how development of everything that we've built throughout our history has been driven. We have a customer obsession. We start every process with a customer and work backwards. We identify a need, we identify a problem, and then we say, how can we work in order to fill that from that need? There's rarely something that we develop just because we think it's an interesting project to take. We always have to justify it back to a specific customer need. We have long-term thinking. We say be stubborn on the vision, but flexible on the details. So we know where it is that we want to get to, but we are happy to adapt on the way on how exactly we are getting to that. And we are very happy to make adaptations based on new information that are coming along the way. If you want to be inventive, you have to be willing to fail. We are willing to go down on a bunch of dark alleys, and occasionally we find something that really works. We iterate and iterate because we know where a problem is. We have an idea of a solution. If the initial approach to it isn't right, we are happy to stop, restart until we get it absolutely right. And we want to always be proud about what it is that we're developing and bringing to market. And you have to be willing to be misunderstood for a long time. We are very comfortable being misunderstood. People asked Amazon, asked Jeff Bezos for a long time, why are you going down a dark alley as before, or in a direction that is counterintuitive? It's because he had a clear vision of where he wanted to be in the future, and he wasn't working towards what analysts were expecting, but what the vision truly was. So these 4 elements are what guide our overall innovation. And critically, a quote that I find very interesting, especially when it comes to healthcare, is that invention comes in many forms and at many scales. The most radical and transformative of inventions are often those that empower others to unleash their creativity to pursue their dreams. To me, this is critical in healthcare, because when we think of innovation and transformation in healthcare, people often think about the really big things, but actually, in my experience, some of the mundane parts of the value chain of healthcare are where real change needs to happen in order to see effect and impact down the line. So it's not just changing how everything is working, but making one change that can actually increase productivity, or can increase engagement, or can increase ability of care to be delivered, can then allow multiple other applications as well as care delivery to be done in a way that actually has true impact to the value of care. We have what we call the Amazon's flywheel, which says that it's not just doing one thing and then expecting things to change. To give you an example of how Amazon thought about it with its initial journey of selling books online, the idea was that if you're able to sell books online, customers will have more selection, because they know that not only have the traditional way, but they can now find things online. By having the experience online, they're having a good customer experience. By having a good customer experience, they're telling other customers, and that brings more traffic. By having more traffic, it means that more sellers are interested in the platform. Because there are more sellers, then the customers have more selection. So that created the initial flywheel. However, that then led to the second flywheel, which was by having a good customer experience that leads to traffic and has a lot of sellers and selection, then we can lower our cost structure. We can use the economies of scale, which leads to overall lower prices, which in itself reinforces the customer experience, and the two are feeding into each other. That way of thinking has guided Amazon across everything it's done. Everything we do has to have a justification of how it is going to feed and support itself. So it's not just standalone, and it's not just one key output that we're looking at, but how it impacts everyone in the process. And that is something that I generally like to impact or to remind startups that I work with, that it's not just doing one intervention in the system, especially in healthcare where it's very complex, that you should be looking at, but you have to consider how everything around it, every consumer, every patient, every caregiver, every caregiver within the clinical as well as family, how they're all impacted in order to continue to have growth and a business model that feeds and supports itself. And one of the quotes that actually is one of my favorite quotes from Jeff Bezos was, he was asked a while ago, how do you think things are going to change in the next 10 years and how do you prepare for it? And he said, actually, that is the wrong question. The question you should be asking is, what is not going to change? And if you focus on those, you will continue to deliver value. So the things that customers are always asking for are good value, low prices, good selection, and convenience. If you focus on giving a product that people want, that is easy to use, that gives them options in making their decisions and at a right price that is continuously either decreasing or becoming more affordable, you will have success no matter how things are changing. So to move into the specific work that we're doing within the healthcare and life science space, but let's focus on the healthcare side. We introduced the Amazon Halo and Amazon Halo Band with the Amazon Halo app. It is a health and wellness membership that provides powerful tools like the Halo Band and the Halo app to help you measure, understand, and improve your health. The Halo app works with Amazon Halo Band to help you observe, measure, and tweak your health and wellness practices every day, from how you move to how you sleep to how you interact with others. It is a startup that we built internally at Amazon from scratch. It started with Melissa Cha, who's the VP of Amazon Halo right now. And then we built a team around her. We use the AI tools that Amazon has, machine learning, etc., as well as worked with partners, companies, startups such as yourselves, who were looking at solving specific problems, brought them all together for an ecosystem that works with measurements, observations, it has the camera use, etc., to actually bring in a real tool that looks at personalizing the health to you by giving you the right insights. Another one of the approaches that we have is Amazon Care. So Amazon Care is a healthcare platform for Amazon employees. It started off in Seattle. It came off as a result of the initial partnership that Amazon had with JP Morgan and Berkshire Hathaway to look at how to have an employer healthcare program, an employee healthcare program for its employees, but now it has expanded to a few other employers as well, and it's gone nationwide. In my knowledge, right now, this is only a US-based product, especially because of how the US healthcare works and is delivered. It has sort of 6 elements, high level. It is a virtual care platform. It has dedicated group of licensed doctors, nurses, nurse practitioners, and registered nurses chosen to help meet the health goals. There's 24-hour chat, as well as being able to see for yourself and your family a doctor online. I guess 2 is the same one on this slide. Ongoing care, navigating, ongoing chronic conditions from diagnosis to management. So as a patient on the platform, you can find specialists to help you manage as well as diagnose your chronic care conditions. Preventative care, evidence-based screening and illness prevention, lifestyle wellness, setting and achieving health goals, and sleep care, personalized assessment and advice, as well as, I think 2 should have been joint care. So anything that has to do with mobility and work-life balance in terms of the healthcare aspect of things. Then we have Alexa skills for healthcare. For me, again, it's a very exciting space because a startup can work with the Alexa skills, which is voice-enabled and driven Alexa features that allow users to engage in a variety of activities in their devices with Alexa. Developers can create unique voice experiences for brands using the Alexa skills kit. And you can be a healthcare or health tech focused company that just uses some of the skills to achieve the goals. I'm just highlighting 4 examples that I find very interesting personally. One is for disease management. So there's a company called SugarPod, or a product called SugarPod from a company called WellPoint, I believe, that integrates Alexa skills to break down activities for diabetes management for patients. So for example, they're able to have reminders. They're able to tell patients it is time to inject the pen or whatever it may be. Improving hospital interactions. Another company called AIVA uses an Alexa-powered platform to help patients interact with nurses and hospital-available entertainment. So inpatient services, especially for ones who are there for the long term, being able to interact and not feel lonely, as studies showed from the AIVA product that the patients were feeling a lot more comfortable by having at least another voice, even if it was digital, with them in the room. Getting live hospital information. Ohio health clinics are allowing patients to get contact information for departments. They can also ask Alexa what are the wait times for urgent care and for specific departments. Lastly, it was actually one of our very own solutions architects. So an Amazon employee is a father of an autistic child. He grew up to adulthood, and they realized that he had a lot of needs for guided routines and reminders in order to maintain his independence in adulthood and in order to be able to live on his own. So he built a system through Alexa and Polexi that was offering a range of solutions to help with routines, reminders, and interactions for autistic individuals. In addition to that, there's a very wide range of selection for helping kids with disabilities, as well as things for anything from autism all the way to just dyslexia. So you can interact with Alexa in order to more clearly ask for things and work on your diction. And as I said, there's a very wide range of potential applications, and it's up to you, the startups, to figure out what the best way to integrate that to you is. I'm living in the UK, so I just wanted to also talk about Alexa skills in the NHS. There are currently over 1,500 organizations consuming content from the NHS website. So the NHS has itself approved what they consider appropriate health information and health content to disseminate. And using websites can be hard for people with literacy difficulties and accessibility needs. So voice-activated devices offer one way for some people of getting around these problems. It is expected that I think by 2025, 50% of searches are going to be done by voice, and it is a very, very growing market. I think the NHS itself said they're expecting it to be about a $2 billion valuation for just the voice-enabled market. Through syndication, third-party partners can integrate clinically approved content and service information through free application programming interfaces, so APIs, or widgets, including anyone building digital products and services. While free of charge, there are specific terms about reporting and branding, plus partners must undertake to make no changes whatsoever to the content. However, any company that is looking at how to talk about healthcare advice, whether it is just doing a search or how to treat a burn or anything in between, how to take care of a child who's choking, where to go, when to call a doctor, all of that can now be integrated through the APIs that NHS has opened up through Alexa. And this was not just through the ASK, but an actual partnership that NHS had with Amazon to develop a more controlled process for that. With what Amazon has done, we've talked about Amazon as a whole, things that we're doing in healthcare, and very specifically my team, which is how we work with startups and companies that are building things out. We are a global team of exited founders, former healthcare and life science investors, and startup mentors with industry experience, made up of clinicians, hospital managers, bioinformaticians, biochemical engineers, and geneticists. Myself, I have a diploma in genomic medicine. As I said, I've worked in telehealth in the US, I've worked in hospitals, I've worked in NHS, I've worked in Tampere in Finland, Karolinska in Sweden. So we're all very, very experienced healthcare professionals. We invest time, we share knowledge, experience, wisdom. We open doors internally and externally. We remove obstacles where we identify them on the technology or business model side. We leverage our global footprint. We inform, influence, and support other Amazon Web Services teams. We champion startups across all of Amazon. We take a long-term view. And when I say we champion startups across all of Amazon, I mean we make connections where necessary. We make introductions where required. If a startup comes to us and says, can you introduce us to XYZ company, we always make an effort. And equally, if one of our big pharma companies, such as no one orders in Denmark, but and this is just one example, but any of our large customers says we have a specific use case where we'd like to have a startup work on it rather than us developing it, we work with all the startups, so we are able to then make that introductions where necessary. Specifically, we've made a lot of effort to develop very actionable information and tools in healthcare and life science. We have quick start guides, which are automated reference deployments built by Amazon Web Services Solutions and architects and AWS partners. Quick starts help you deploy popular technologies on AWS based on AWS best practices for security and high availability. These accelerators reduce hundreds of manual procedures into just a few steps that you can build your production environment in minutes and start using it immediately. Again, those are very specific to healthcare and take healthcare realities into mind to build that. And we have others for other industries as well. But again, I'm only going to talk about healthcare. In addition, we have white papers where we have collections of information and how to overcome certain blockers, such as patient hospital information access via telephone, telehealth meets cloud, digital strategies for vaccine distribution and administration, genomic data transfer analytics and machine learning using AWS services, and GXP systems on AWS, which talks a little bit about compliance and security. Finally, AWS enables HIPAA compliance. It enables customers to build HIPAA-compliant applications that store, process, or transmit protected health information with a business associate agreement addendum available. And HIPAA-eligible services from AWS for a broad range of applications and compute storage, database, managed big data, archiving, data warehousing, and networking, where products are, again, very specific to the healthcare industry. I'm going to pause there. I know I said a lot of things, so we can have a short discussion, as Valentin said, but I hope that this was informative and enjoyable for everyone.
Oh, thank you very much, Laura. It was very informative, and we've been speaking for a few hours in the past few days, and it was still very informative even for me. We'll get into a couple of questions. In the meanwhile, I would like to ask everyone that is at home or in the audience to write their questions in the chat, and we'll pick them up as we go along while we discuss. So one of the core elements that you mentioned around that it sits at the core of Amazon is the fact that you start every process with the customer and work backwards. Now, yeah. a particularity of healthcare is that here we have multiple customers that we need to work with at the same time, and that are not necessarily aligned. They have different incentives sometimes, and so forth. What is your approach? How do you work backwards from the customers in this particular situation?
Absolutely. So first of all, thank you. It's one of the best questions I've had recently, and it's a very key point. In healthcare, you have to understand that there are 4 customers in everything you do. There's a patient, there is the physician clinical care team, there's the provider, and the payer. And there are thousands of digital health and healthcare startups that are trying to make it, and we see not all of them becoming successful. In my experience, or in my view, in order for a healthcare company to be successful, even if they're only looking themselves and they think of their customer as the patient or the clinician or one of the 4 Ps, they need to say, they need to understand how all the others are going to be impacted and are going to help in the adoption, because in a way, they will all be customers. So to give you an example, if you're looking at creating a solution that impacts discharge planning, you have to say, how will patients benefit from it? How are they going to interact? How are they going to adopt? How are they continue to engage with it? Will that change the clinical processes and the workloads that the clinical care team, physicians, etc., are going to have? Will that create more work? How long will it take for them to learn it? And what else has to change around it? If that doesn't happen, the patients are never going to get it. If the providers aren't willing to understand how that fits overall, what the impact of the intervention is going to have on outcomes, then they're going to be less likely to engage with it. And lastly, it has to be able to be paid for. So all 4 need to be there in place at all times, and you have to work backwards from all of their needs, or their engagement with it in order to make sure that the solution is going to be adopted, is going to be paid for, and is going to continue to grow.
Thank you. Very interesting insights. And now you spoke about the case of NHS and particularly the case around the autism solution. Could you zoom in a little bit more on that and give us a few more details, as much as you can share on how that came about, how that came to happen, because it's one of the, at least in Europe, it's one of the good and few examples where a company like Amazon works with a very centralized and fully public health system.
Of course. So are you saying with NHS or with the autism specifically?
The collaboration with NHS.
Oh, okay, so with the NHS, basically, first of all, it wasn't the first time that we collaborated with health information. Mayo Clinic and Cleveland Clinic also have similar partnerships. So Mayo Clinic was the first one that had that created an application through Alexa where patients could ask for healthcare information, and it was well, my Alexa is also talking to me. So you could ask her, can you give me information about how to treat a burn? So we saw that that was working really well, that the information being provided back was accurate and was actually being used significantly by the patient group. So the NHS itself recognized that it is very important that patients are receiving data that is accurate, that is actionable, and that is not just another Google search. So since they have a huge library of data and they are working through syndicates with, as I said, 1,500 organizations who are getting their information, they didn't want there to be just an SDK. They wanted to have a lot more control over the content and the branding so that there was actual accuracy so that you don't have problems down the line. So the partnership that we developed was to create the library of data, and the SDK, then the ASKs, the Alexa skill kits, were only available to get the full information out with NHS maintaining control. So it needed to be a lot more of a partnership to build that library, not just the way to access it.
Thank you. And I see that there are a number of questions starting to pop on the chat. And before we go to them, one last question, zooming in regionally a little bit closer to us as well. You've worked with organizations in multiple regions and multiple countries. How do you see the pace of adoption and growth in Northern Europe versus the rest of the world? Do you see any particularities? And please be as honest as possible. Where is that we lag behind, and where is it that we shine?
Yes, so I'm going to talk observationally. It's not necessarily that they're customers or not, but I'm just going to say what I've seen. First of all, I am extremely impressed by what is coming out of the Nordics as a whole, and Denmark specifically. There are some companies that I think are going to be impacting care globally. There are some companies that are really shining lights, and maybe the US doesn't know that it's coming from the Nordics, but they're extremely successful. Some of them that I really like are the Oura Ring. So I wear the Oura Ring. It's a fantastic insights company. It's improved my sleep. It's based out of Finland, and yet it is extremely successful in Silicon Valley. Crew Levy is a telehealth platform that is doing extremely well in Europe. They just raised, I think, over 300 million this week, doing fantastically, and they're rivaling every big telehealth platform in the world right now. Nightingale Health, again, I think, if I'm not mistaken, from Finland as well. Fantastic company. We had an event last week where I interviewed one of my customers called BioMe, which is a microbiome diagnostics company. They have partnerships. They're based in Norway. They have a partnership with a longitudinal research company in Norway itself. Fantastic outputs coming out of them. You have Omhu in Denmark, which is doing AI for dermatology. You have a wide range of AI companies that are looking at either digital health or engaging with the patient records, patient digitization, that I think are very impressive and are very quickly being adopted globally. Another one that actually is working with Halo Band as well, and the Halo app is LifeSum, and is rivaling MyFitnessPal. So they're all companies that are doing extremely well, that are understanding the problem, and that are looking at the market as a whole. And there's a huge benefit, I think, in the Nordics, where healthcare data is digitized, where the patient record is already on computers and not just on paper. And I may be laughing slightly, but I did work in a hospital that is very large in the UK, where all the patient records were on paper and sent in trucks in data centers or warehouses, and then sent back every time the patient was going back. So it's a world apart. So I'm extremely proud of that. I'm also very impressed by how much genomic data is available in the Nordics as a whole. And again, the genomic databases, the biobanks there are a class above, in my opinion. And then lastly, of course, there's a lot of biotech research that is coming out of the Nordics, but that is, that's a different part of the industry. I think the healthcare side of things and how you work with hospitals, how you digitize things is extremely impressive, and something that I'm more than excited to work with companies on. Another thing, which I think is a slightly different aspect, is how you get investment in the companies. So in the US and potentially a little bit more Western Europe, we see that investors, especially venture capitalists, take a position of build fast, fail fast. If it works, great. If not, we'll just go on to the next thing. And you have those serial entrepreneurs, which is amazing and extremely successful in that model. However, what I have found with Nordic companies, and I think is very admirable, is that the culture of the Nordic people has been maintained through the startups that we're working with, within healthcare, outside of healthcare, and across. There is a general behavior, and correct me if I'm wrong on that, but what I'm seeing is that, and when I worked there's a culture of consensus building and confidence. So what I've seen with the startups is they build a solution, they test it, they get an internal consensus, they get everyone on board, and then once they're sure of the next step, they move on. There isn't just a run, and then if it works, great. If it doesn't work, well, whatever, we'll try the new thing. There is a lot more desire to actually make sure that they've taken perspectives from different people. And as an Amazonian myself, I think it is very reflective of our principles. A, there's a customer obsessions because they think of internal and external customers. And B, we have something which we call have backbone, disagree, and commit, which means if you have an opinion, say it. If you don't agree with someone, say it. It's not embarrassing. But then once a decision is made, you commit to that and you all come on board. And I think that is a very Nordic quality. And I'm very excited to see that whenever I'm on a call with a Nordic company, there is always complete agreement on the internal side as they project it to us externally, whether internally they agree 100% or not. Lastly, the investors in other countries give a lot of money very quickly. But they also take a lot more of a controlling stake in the company. Whereas from what I've observed again in the Nordics, even though money is invested maybe a slightly more conservative way, but more frequently over time, more control of the company is given to the company. So strategic decision making is left to the company's founders and executives or operational managers to continue on the vision that they have. So the way that I was saying before, have a vision, but the details are going to build themselves out. Again, it's a way that we really like to see companies building themselves.
All right. Thank you very much, Laura, and we could go on for the entire week. As you know, I'm going to go now to the chat and ask a couple of questions that that our guests put up. I'm going to start with the one that is most voted here. How is Amazon's health strategy in the US likely to impact the Danish life science industry?
Great question. I think there are two-part answers to this question. There's the Amazon businesses, which I just mentioned, sort of Halo and Amazon Care. Amazon Halo is only in the US right now, and Amazon Care as well. So neither of those do I know of plans currently to expand in Europe. So I cannot speak about that. How we're working in terms of our products that are within AWS in healthcare, we offer that globally. And I'm not saying that lightly. It is a big split. I know we have different businesses, but these are the only things that we currently have within healthcare there. Everything else that we have on healthcare is within AWS. And as I said, it's completely global. We work with companies around the world, and we have regions locally in Europe as well in order to be able to offer products, AWS products to startups in local markets and be able to reply to compliance and security needs locally. Having said that, the only caveat or change that I'll put is we have a team that is locally here positioned. So I'm based in EMEA. I have a colleague who's based in Israel called Guy Spiegelman. And then we have a colleague in Denmark as well, who's not dedicated to the healthcare team, but he is part of the startups team. And when he sees a healthcare and life science team or company come up, he connects with us to make sure that we're connected to the company and give them any kind of effort that we can. In addition, we have a couple of things that we offer globally to startups specifically, which is a virtual Ask an Expert bar. So any company that comes to us and says, I need to talk to someone who's an expert in XYZ, we can connect them to someone in the US, in Israel, in China, whatever that may be, because we try to be very global in our approach. The only differentiation is on public policy or matters of legal aspect of things. We will adapt, and we may have things that are slightly differentiated here in order to respond to that specifically.
Great, thank you. And this is, I think that this is part of your answer is linked also to one of the questions regarding regulation itself. One of our guests is asking, how are you working on resolving or adjusting the data privacy requirements in the countries?
So again, part answer. First of all, with DIGA specifically, we are working on it and it will be resolved. Do not worry. We have a whole team working on that specifically. Where this is coming from, obviously, we are working with within the GDPR guidelines. We have options such as outposts and hybrid, so you can keep things locally. So copies of data locally, whether it is on an Amazon Web Services data center itself, so in an availability zone or an edge location. So there are ways to deal with it. We have to look at it case by case and see what the best approach for that case specifically is. But if I can go backwards into why these issues have come up, my understanding of it, and I'm sure there are many interpretations, but my understanding is that there was a Cloud Act a couple of years ago written in the US, which then created a wave of reaction, both on the GDPR as well as locally in the Nordics. Different organizations wrote different things. What the Cloud Act says is that an American company has to provide data from their servers if the government asks for something. It is very important to note that previously that was also available. What the Cloud Act did, unlike how some people wrote about it, it actually created a very specific guardrail and process for that to happen that actually made it a lot more difficult. So whereas it was interpreted as it makes it easier, it actually made it harder, because now any company that were to ask for anything, they'd have to have an extremely specific link as to how that caused a terrorism issue or something related to that. then they would have to go to the court, ask for a subpoena, have the link, have the specific person, time, and reasoning as to why they're asking for that information, and then only get a very, very, very specific answer back, which makes it a lot harder than it was before. So I know that it was very easy press to write about these things, and it gets people's blood boiling, but actually it made it a lot harder. So we're confident that this should be fine. And again, we have entire public policy teams working on every market specific needs, and we have built solutions, outputs, and hybrid that respond to them.
Great. So working on it. One last, looking at the time, one last question.
Yeah.
From Liam, regarding patient records, is Alexa playing a role in automating the processes of updating patient records through its voice capabilities? And if not, do you foresee it's going to go there?
I don't know if Alexa itself is playing a role in automating the process. Well, actually, the rest of his question is by capturing voice data from consultation. So it's not Alexa itself. I think it's more a company who's interested in doing that can work with the ASKs to build an application that does that, or to build a company that does that using and utilizing the Alexa skills. So there are different tools there. In addition to Alexa, on the AWS side, we have Transcribe, and Transcribe Medical specifically, which is an AI process that actually captures healthcare information and conversations from natural language processing and then digitizes it. So then you could combine potentially the two.
Great. We have room for one more question. So I'm going to take the last one. Besides using various AWS services, are there any other partnering opportunities with Amazon? And I'm going to cheat a little bit here because I know part of the answer, and I would like to ask you specifically also about your efforts in matching and connecting some of your customers, because you work with very, very large and with very small customers as well.
Yes.
Could you tell us a bit more about what you're doing there? And
absolutely.
How you're doing?
So first off, if the question is, so there are a couple of ways that we can partner. We have the Alexa fund. So Alexa has a fund itself that if you're building something with Alexa skills that can then become a company related entirely to Alexa, from my understanding is there is a fund there where there is a small pot of money. To my knowledge, it's the only investment or corporate development part that we do. Secondly, as you said, there is the Connections program that we are extremely excited about, and that is through AWS, but purely because we see a company starting out using some of our tools, and then we do match them with our large enterprises. So I spend about a quarter of my time on AWS Connections, where we have, as you said, some of our largest enterprise customers. Again, specifically last week in our event, we had executives from Novartis, Merck, Johnson J&J, and Roche talking about how they work with us to source companies on the startup side. I'm trying to think of an example that I can use. So actually, we had a pharma company saying we are now launching a drug in the sleep ecosystem, and we want, in addition, to have a company that offers services around sleep monitoring, sleep reporting, etc. They were a pharma company. They focus on pharma. They did not want to build an application around it. So they came to me and they said, do you have companies in Europe specifically in the sleep ecosystem? Similarly, one of those large pharma companies has a product in breast cancer, and they said, we want to have an application that can be a wraparound service that clinicians and patients can use for reporting adverse events and any kind of issues that they may have with a drug, anything around compliance, etc., etc. So again, they didn't want to build that. They came to us. I work with thousands of companies in Europe, Middle East, and Africa who are specifically in healthcare and life science. So I have a view of where they are, what they're doing, at what stage of development they are, so that I can then make that connection. Lastly, it happens to be through AWS again, but because we work with the venture capitals, incubators, hospitals, etc., we again can make introductions where necessary. But very importantly, because we work both with the hospitals and with the startups, we sometimes may go together and we'll say, as we're going to the hospital, we'll say, well, it's not just building AWS for your records, but it's also if you want to really be looking at value-based care or impact in the system or how you're changing how care is delivered in the hospital, and you don't want to change everything, maybe you need to be testing things out. And in healthcare, it is really important to define what the value of care is, you know, the classic definition of outcomes over cost. It's easier to do it by having a specific pilot where you make an intervention, you test it, you look at it, you can analyze it, and then you can either deploy it further out or take it out. By having an AWS environment or a cloud environment within the hospital, even if it is limited, then you can keep putting in startups and solutions on top of it, and we can work with both the startups and the hospitals to make that innovation happen locally in the care delivery.
Sounds great and very exciting, and we look forward to having you here at the hub very soon. As soon as
I
this
cannot wait. I have as Tarang, my colleague who's local, knows, I have a special love for Copenhagen. I lived there for about 6 months, and I miss it, and I miss the hot dogs. I miss the food every day, so I can't wait for things to open up so that I can be back.
Great, and you have a warm seat here, and we can talk further about the connections and about bringing together startups and hospitals as well, because as you know, this is something that we've been doing together with a lot of the partners as well, and we plan on doing quite a bit more of with you as well.
Great. And I see Tarang has put his email, I think, in the chat. I'll put it as well. Anyone can reach me whenever they want, and we're very happy to talk about whatever it may be.
Thank you very much, Laura. And now I will wishing you a good day, and I'm going to turn the camera off and pass the stage back to Denise.
Thank you, Valentin, and thank you, Laura. And what a great conversation around Amazon and your healthcare journey. Next up, we're welcoming our own Martin Vesterby to the stage to introduce you to the Health Tech Adoption Award of 2021. So welcome, Martin.
Thank you, Denise. And now, without any redundancy in sound, thank you so much for attending today, and again, congratulations with the birthday. We are here to also present something that is new to us, and what we've been working on for a while is to present what is named the Health Tech Adoption Award. So what we are going to do here for the next few minutes is make an introduction to the award, but also present the reason why we are thinking that there is a need for this award. And there, it's a picture of me. And if you have anything that you think that you need to share with me after this presentation, or you need to learn more about what we're going to do here, please reach out. You can find my contact information on the homepage for Health Tech Hub Copenhagen. But what is really important here is the Danish health tech startup ecosystem. We have many companies in Denmark working on creating value for the healthcare sector, for the clinicians, for the patients, for the payers, and they want to have impact. They want to reach out to the ecosystem and get those projects up and running and get them tested, doing some pilots, and perhaps most important, also get some customers that are actually adopting those projects. And a bit provocative, I have a claim here. I have a claim that we in Denmark is the land of prospect and projects, but not so much of contracts and commitments. And that's one of the reasons that Health Tech Hub Copenhagen is existing. We are trying to help facilitate the connection between the startups, the companies that want to create a business and a sustainable business model, together with value creation with the clinicians and the healthcare providers, so we can actually make those impacts out in the patients' homes and in the lives of the patients that are in need. So we are trying to see if we can continue what we have already started here, but bring more focus into the companies that are actually getting their solutions out and adopted into the healthcare system. Meaning, when we are doing that, we also need to have some kind of guidance in regard to who are we going to celebrate. We are going to celebrate health tech. And when we look at health tech in regard to this awards, we look at health tech as a digital health, uses technology, primary software using databases, application, devices, wearables to positively affect the quality, affordability, accessibility, and availability of health and well-being, and ultimately improve quality of life. I think everyone who is connected to the hub and know what we're doing here can sign up that this is something that we are all trying to do. And this is also an agenda that we try to push. But there's no value in health tech if it's not out with the end users and actually creating the value that they are intended to do. So we are also looking at health tech adoption. And when we talk about adoption, we talk about the acceptance, integration, and use of new health tech in society. There must be a supplier, could be one of the companies in Health Tech Hub Copenhagen, but it's not an exclusive thing we're trying to do here. So the supplier can be anyone who is actually presenting a health tech solution for the healthcare sector. We need a payer and actually users of the solution before we in the hub and as part of this award are claiming that this health tech is adopted. We're looking into 3 categories this year for the Health Tech Adoption Awards. We're talking about frontlines, where we look into GPs, general practitioners. We look into emergency medical services, municipalities, communities, health workers, and there might be other candidates in this area or category that we are naming frontline. Then we have what we call specialists, and that's not for saying that people that work in the front lines are not specialists, but it's supporting the picture we have of specialists working at hospitals, meaning the providers of solutions that are closely connected to the hospital systems, what we also call the secondary sector. It could also be specialist care that are taking place out in the primary sector. So it's not exclusively located to the secondary sector, but it's specialist care for perhaps a niche group or patients in need of some kind of special treatment or support or rehabilitation. Then we have the last category that we call cross-sector. The cross-sector is something that in Denmark is extremely relevant because we have many issues with the connectivity between primary and secondary sectors. Putting it a bit simple, the connectivity between the municipalities and the patient's home and what is taking place at the hospital. That could be both in regard of support of patient and relatives. It could be of prevention. It can also be in regard to treatment, and it can also be just data sharing solution that makes it easier and make it more accessible for healthcare providers working in the primary sector or the secondary sector to get insights on what is actually taking place in the other sector, and thereby supporting the patient and improving the way that we can actually increase value of life and quality of life for patients suffering from diseases. Now we have the categories, and we could ourselves here at the hub also go out and make the decisions in regard to who is going to be handed out the prizes. But we are actually calling in bright people from outside Health Tech Hub Copenhagen to help us make the final decisions in regard to who is going to be the receiver of these awards. So we will have a jury of 5, and we have already selected 2 members of our jury. One member will be Lars Holm Nielsen, who is head of Better Regulation, Entrepreneurship and SME Policy at the Confederation of Danish Industry. Lars has a long track record of trying to support especially the SME segment in regard to making it easier for them to get their solutions out into the public sector, mainly public sector as a customer here. And he has a long history and much insight into also all of the governmency that are needed in regard to this. Then we have Trine Vindery. Trine Vindu has a background from MTech in the Central Denmark region. She is now the Vice Dean of Innovation and External Relation at the Faculty of Health and Medical Science at the University of Copenhagen. That means that Trine is the one that is connected to many of the companies that are doing research within health and medical science at the University of Copenhagen, but she is also connected to many of the spin-outs that are actually being brought up inside the walls of the university and then being spun out into new companies that might end up here at the Health Tech Hub Copenhagen. So these are very influential and people with great insights into some of the issues that we are having with adoptions of solutions in the healthcare sector. One of the things that I asked these people were to actually come up with statements in regard to why we need to focus on adoption. And Lars was saying, as a society, we are privileged by a high level of innovation and wealth of ideas and creativity, combined with a world-class position in life science and health technology. Yet it is relatively difficult to bring innovative solutions to prevention, diagnosis, and treatment to market. If we can succeed in broadening the passage between innovation and the market, we will also open the door to a world market. Trine has also a statement, and it's pretty much aligned with Lars, so that makes sense to us because it's also carrying the values that we are looking into here from the hubs. And that is, today we can easily help new companies create the world's best health technology, but we cannot help them sell to the public healthcare system. And it is high time that we get this fixed. It's necessary to ensure the opportunity to test and complete the development of their products and solution, but to a large extent so the companies can get a chance to sell their products outside Denmark's borders. We concur from our side that this is a need. We need the companies in Denmark to get an easier access to actually connect to units, to municipalities, to hospitals with solutions that they can sell. And we need to have that up and running so we make it easier for them to actually go out and extend their solutions to outside Denmark and scale their solutions. We will over the next time also present 3 more members of the jury, and they will include members from outside Denmark. The award is actually inspired by the Hermit and the Shell. We look at this as a way to present a metaphor for what is needed. The Hermit is the startup. The Hermit is a pretty fearful little fella that are out there ready to fight, but it has a soft back and it needs to get protected when it's actually out there growing and try to live. The shell could be the payer. It could be the hospital, the municipality that actually take the first step and are actually including the solution from the Hermit in their everyday work and not only buying, but actually using that. So the recipient of these awards will be a partnership between a crab and a shell. So it can not only be a company or a municipality or a hospital or a healthcare provider. It has to be a partnership that will receive these awards. The dates that are coming up for this is that the nomination will open up on 1st of June and will close on the 13th of August. We will then do an evaluation with interviews and look into due diligence, and we will announce the finalists. Afterwards, the jury will look into each of the candidates and make their selection, and then we will have an award show taking place on the 29th of September. That means that you have time now to go in and dig into all of the teams that you know of that could have relevancy for this awards. And I have to be frank with you guys. We will look into that the solutions are not only up and running. We will also look into that they are actually creating value. We will look into that there is some kind of evaluation of their effectiveness and efficacy. And we will also see if there's anyone who's actually published any journals, articles, or anything that can actually support that the value creation is out there. And we will try afterwards for each of these companies to help them get the push they need to take their technology from Denmark and from their partnerships into new areas, hopefully outside Denmark. If there's anything you need to learn more about this, please reach out. There'll be an announcement both on LinkedIn and on our homepage in regard to the steps with the nominations, the evaluations, the jury, and the award shows. And during those when we are giving those informations, we will also share more knowledge in regard to what we mean when we say partnerships and what a partnerships need to be consisting of before you can actually be a candidate for this award. So please reach out if you have any questions or anything you need more information in regard to the Health Tech Adoption Awards taking place on the 29th of September. And if you're wondering about the date is being selected because it's close to the Health Tech Summit taking place here in Copenhagen the day after. So our award show will be like a startup, a warm-up for what's taking place the day after. So a great reason to come to Copenhagen for the 29th and on the 13th of September. Another thing that I'll just plug here before I sign out is an upcoming event here at the Health Tech Hub Copenhagen. We have been working with many startups that have had great insights from experts in regard to the need of their solution. And they have been working with clinicians and researchers to create that evidence that can support their solution and make it easier for them to go out and scale. We have also seen examples that the insights in regards to study designs and what it actually means to run a study in a healthcare sector that can support the outcome of your solution might sometimes be strengthened a bit by better insights into what is actually a study design and what can you include in a study design that can support sale and scalability of the solution that you're sitting with. Meaning that on the 8th of June, we'll have an interactive online event. There'll be a registration possibility during
Eventbrite.
Oh yeah. So you can hook up there and then you can sign up for this event where you'll be able to get a 1.5 hour introduction to what is the need for research and study design when you have a health tech product. How can you actually also push back in regard to the researchers so you can bring more of the data you need into the studies. We call this event From Expert Opinion to Real World Evidence, and we'll touch base on anything from quantitative to qualitative research, how to merge data, but also how to make sure that you get some insights in regard to data that can support a business model and thereby support a sustainable business model for your company. So look into that, and hopefully you will also attend that. Thank you so much.
Thank you, Martin. That was great, and I love the metaphor of the hermit and the shell and how they're kind of codependent. Next up, we're closing the loop by looking at the future of health tech. So we're welcoming back our CEO Jesper to the stage.
Thank you, Denise. First, before I actually go into what's next, we actually had a small slide hiccup in the beginning when I was missing a slide that fall out of the last minute's uploads. So there was actually 2 or 3 other success stories from last year that I didn't manage to share, and I'll just start with sharing these because first last year, as we also heard, we had our first IPO. So Monsanto was the first health tech hub member to IPO. I believe we'll see more in the coming months, but that was great. Then we also had Linus, our fastest growing startup, the first hub member that received hypergrowth. There were 8 people around 3 years ago when we met them. There were 120 people a year in July, and now there are almost 200 people. Very, very impressive growth and operating in 4 countries. And then 2 other things. We had 10 new members joining the Health Tech Hub last year. We had Practio, we had Studies and Me, we had MySkin, we had Drugstars, we had Howdy, we have Cora, we have Liva Healthcare, we have Visicon, Hi Doctor, Hedia, and Brain Plus. All fantastic members that have chosen to join us, and we're very happy to work with these people. And then the last thing was that we also formed a formal partnership with Digital Hub Denmark, where we help them and they help us to attract talents to Denmark, which is badly needed. We attract investors through them, and we attract delegations from abroad. A great collaboration with them. So that was just a few things of the highlights from last year. Now I'll change the scene. I'll try to go into some global trends that we see and have seen in the past. The first trend is what we call from physical first to virtual first. This is something that the entire world has experienced, where we used to almost per default go down to our local GP to see him or her. Now, quite often we speak to the GP over the phone or have a video consultation first, and also with hospital systems. We believe firmly that this trend will continue. We will see much more treatment, diagnosis, diagnostics, prevention being happened at people's homes, in people's offices, not in the typical physical premises. So that's a trend that we really see happening across the world. Then we also see an increased number of collaborations, very interesting collaborations and merger and acquisitions. We see very large players are collaborating with others. In the US, for example, a few months ago, 14 large hospital players pooled all their data together to get new insights, since more data is better than less data. And using data and having bright minds find uses for it, Trump owning 100% of fragmented data locked in a vault. And I believe we'll see many more of these collaborations and many more collaborations between large companies and startups, and also M&A activities. Then in the US, we've seen the FDA moved very fast. People across the world have actually been pretty impressed. They've led the way in actually approving officially what they call digital therapeutics. And they basically look at health tech and digital therapeutics as they look at drugs. So they have a similar and faster process to approve digital solutions, still obviously living up to regulatory approvals and certain quality measures and evidence and so on, but they are approving them and they're getting reimbursed. And that's all from autism to drug abuse to HTHC and many other solutions in the US. In Europe, we've seen DIGA show the way, the German Institute for Digitalized Products and Solutions, where the German authorities have actually formed a unit that works very similar to the FDA, looks and approves digital health solutions and push them out to general practitioners. So if you go to the doctor in Germany, you can now be prescribed medicine, but you can also be prescribed a digital solution app or solution. And this is very inspiring for us. And this is something that we're also very pleased to, that we will hopefully can copy and learn from in the Danish market. Then we see a huge trend in increased funding. The funding has been phenomenal. This quarter was a record-breaking quarter. The Q1 of 2021 was already record-breaking, 31 billion worldwide US dollars. Nearly 2/3 of them, though, being in the US. There's no doubt that the US is leading the way in terms of funding and in terms of having very, very large and very well-funded companies. However, we do see the same things happening in Denmark, as I said in the beginning. Last year was a record year for Danish health tech, and this year is already, we are 1 quarter in and we are more than 60% on last year's record numbers. Then the last thing, I think, which is probably the one that maybe is going to move this market the fastest. And I think that this is, thanks to, or one of the few benefits of the COVID pandemic, is that the consumers and the professional healthcare workers have throughout the last year really seen the value of great health tech solutions. Everybody has experienced something that they didn't experience before. Everybody has seen, wow, I can be in my summer house, I can be in my apartment, and I can still get good clinical advice or treatment. And we believe that this experience that people have had will mean that after COVID has removed the burdens of society and lifted up us to think about new things, then we will see many, many more solutions being required and asked for by consumers, but also being asked for from professional healthcare workers. So this is a key trend. Then, if we look into the Danish market, what do we see there? We definitely see that the insurance and pension market is slowly waking up. You know, and when I'm saying slowly waking up, that's because in other countries they have been faster in embracing health tech. But I think they're slowly waking up. We hear about more and more positive dialogues around these pension companies and insurance agencies that are speaking to health tech, and we believe that they will begin to incorporate and use health tech solutions to deliver better health to their customers. Then as we said, we have the new life science strategy. It's a 3-year strategy. It was just announced. It still needs to be approved by the government or the Folketinget in Denmark, the parliament. And one of the things that I would encourage you all to read it. It's actually a pretty good reading if you're interested. And it has 38 initiatives. And one of the initiatives, we are happy with 3 initiatives. We are happy that it's supporting better use of data, and it's using Denmark as an exhibition window. And under exhibition window, there's one initiative that we are specifically happy with, and that's the initiative which is kind of mirroring what they're doing in DIGA in Germany, is that we will work in Denmark to have general practitioners to prescribe digital solutions to the patients. And this is an area that many of our startups have worked hard on pushing, and it's also really needed for them to get their experiences with this type of regulations and procurement and so on to move into the rest of the world. So this is very exciting, and also exciting for consumers as well and patients. Then we think we hope that we will also use this new life science strategy to change the mindset of buyers. Because even though that the life science strategy now, 3 years ago, the life science strategy had 30 million kroner allocated to it. This time it's 280 million kroner. I still believe that's way too little compared to the possibilities and possibilities we have in this industry. However, if we use the thinking that's done in the life science strategy to embrace that in the buyers, then I think we can understand that, and the buyers actually believe that, hey, now let's make Denmark this showroom for new innovative solutions. Then I think we can really make a big difference. And I think what Laura said from Amazon, you know, she is very impressed with some of the facts and conditions we have, our data, our GNOME data, our culture. So we actually have many of the right things in place to do this. And I think one of the last bricks that we need is actually to have the buyers also understand the role they play. Martin was also talking about this. Then we believe that we will see more collaborations. We will see more collaborations between the existing life science industry and startups coming back from the global world. This is something that we're working on very actively on a daily basis, since the startups needs the sales muscles and distribution models, and also the knowledge of all the large companies. But the large companies also often needs the innovation drive and the understanding of tech from the startups. So we really want to see more collaborations, and we want to work in this area. Then, as Laura also said, and is that we do want to see more investments. We've already seen many more investments than we have in the past. But we've also seen that most of the investments are done by non-Danish investors. And we would love to see more Danish investors investing in this area to help keep some of these startups Danish in the long term. And then the last thing is coming back to Martin's point as well about smarter evidence gathering. We believe it's very critical in this area to get evidence, and get evidence means to do it the right way. So that's why we are partnering up with these hospitals. We had our newest collaboration with Rigshospitalet, but hopefully we'll see more hospitals joining us as well. Joining us together with startups to make the right evidence, and the right evidence faster. That is very key to success in this area. Then I will end up with a key challenge. And I think Laura put it very well. You can see the question was framed by CB Insights 2 years ago, but I think it's very key still. Will tech understand healthcare before healthcare understands tech? I think you all heard what you got a little bit of snip into Amazon, how much they invest in tech, how much they invest in understanding healthcare, how many healthcare professionals they have actually hired, how many really senior people they've hired, how much they're investing in healthcare. However, we still see too few healthcare companies, and I mean traditional healthcare companies, investing in understanding tech. And we are trying to bridge this gap, but and we will work hard on this. I want to thank my amazing colleagues and team here. You know, these are the people that made this event possible, that made the results possible the last year, together with our startups, the 21 startups that we have. But these people are outstandingly, and I'm very, very happy and proud to work with them. Then at the last minute, I just want to say we have 2 events coming up. We have Martin's events about creating real-world evidence, and we have the Adoption Awards, and we will also have more events to come. Thank you. Follow us on LinkedIn, subscribe to our newsletters, and follow us on Twitter. Thank you so much, just in time. Have a great day.